Hello everyone, welcome to another episode of Momstar Series, and I feel so happy today to introduce you to a mom who is very strong, and she is mother of twins and still being very moving very strong into the journey of exclusive breastfeeding. So today this is a privilege to invite her here and we'll listen to her story, and I know that it is going to inspire you all who are facing any issues in their breastfeeding journey. Welcome, Apoorva.
Thank you, Dr. Tanima. Hello, everyone.
So, Apoorva, please tell us in brief about yourself.
Okay, so my name is Apoorva and I stay in Bangalore. I have recently had twins, a boy and a girl, and they are 3 months old as of their birth. Initially, as Dr. Tanima would know, and for everybody else, I was not able to breastfeed them because of their low birth weight. They were born a month preterm, and that is why I was not able to breastfeed them despite lactating, or rather milking from my 7th month of pregnancy. So I was quite happy and quite confident and excited about lactating post pregnancy, and I was. However, due to the baby's low birth weight, I was not able to latch them or put them onto my breast, because of which they were mostly on the fed milk that I could pump. So I did pump for a good 1.5 months, wherein my babies were also in the NICU. So there was a separation between me and my babies for a brief period, for like 15 days for my girl and 4 days for my boy. And post which, when I got them, I was still not able to breastfeed them, because the target was to put them back to at least 2 kgs. I got them very small. They were both same birth weight when I got them to take home. And it has been a journey. It has been a big struggle for both me and my husband from there on, feeding them through palada, and then eventually, moving on to bottle feed, which we did quite recently. That's when one of my friend, and that is when I saw that my baby boy was starting to latch. But then I also realized that my volume of milk, the supply has gone a lot low. And probably that was because of the fact that for so long I was not able to breastfeed the babies. The babies were far away from me. There were so many other struggles, physically and mentally, that I was going through, that had affected collectively my breast milk. And I was so sad and so low on confidence. I really wanted to connect with my babies. I was very, very sure about breastfeeding right from the beginning of my pregnancy, and not being able to do was just adding to my entire mental trauma that I have had post delivery. That's when one of my friends suggested Dr. Tanima's name, and I'm so glad that I connected with you, doctor. I actually do regret not calling you up before. I had your number from like a couple of weeks before I called you. And yeah, so it has been magical. Like, I could sense the sort of confidence that you had in me right from the first time we spoke. And when you said that, the best thing about me right now is that both babies want to come up to the breast, right? And the way you were talking and the way you imbibed that confidence in me gave me the confidence. I went into that 10-day thing with you with a very positive and very confident outlook. And in fact, my idea was never to exclusively breastfeed, because by the time I met you, I was of the idea that even if I'm able to give them 50% of their feed, my milk, I would be more than happy. But you were always very confident that, I could put them both onto breast milk, and that could happen in the next 10 days. And that almost felt surreal to me, absolutely not happening. But I had that confidence in you, and eventually we reached there. With the boy we reached quite early. With the girl there were still struggles, but there was no struggle of me lactating or my milk supply, or the sort of confidence now that I have with my babies and the entire breastfeeding journey.
So I would like to just let me know in the point, what was the biggest challenge in your breastfeeding journey? Like you have already told me, but in pointers, if I ask you, what were the points which were big challenges for you?
So I think सबसे पहले तो मेरा सप्लाई जो कि कम होने लगा था by the time बच्चे 3 किलो के हो रहे थे, and the doctor told me that, my pediatrician told me that now is the time you can breastfeed. Number two, another बड़ा challenge ये था कि पलड़ा feed से वो bottle feed पे जा चुके थे. So I knew that, and I knew it before my pediatrician told me that bottle से breast पे जाने में दिक्कत होती है. So my another biggest problem was that what if they just never go on the breast again, and I think उसी reason से I used to continue keeping them even though there was low milk supply. मैं चाहती थी कि वो लगे जिससे कि उनको वो चीज मिस ना हो जाए इन सब चीजों के बीच में. आई थिंक दीज टू वर द बिगर चैलेंजेस. नंबर 3 वाज, आई थिंक देयर वाज अ लॉट ऑफ स्ट्रेस. मुझे मेंटली बहुत ज्यादा स्ट्रेस था. आई हैड अ लॉन्ग पोस्टपार्टम blues period. Also my therapist, so I had been in therapy pre-pregnancy, during pregnancy, and after pregnancy also. As in when I require, I do that. And I suggest that to everybody through your medium.
Of course, that is very important. Yes.
Yeah, and that's when my therapist told me कि भाई twins के साथ hormones settle होने में ही 6 महीना लग जाता है. So जनरली पोस्टपार्टम एक बच्चे के साथ 3 महीने में खत्म होने लगता है, लेकिन तुम्हारा शायद 4 से 6 महीना लगे. सो मेरे लिए वो भी एक बहुत बड़ा चैलेंज था, बिकॉज आई एम अ वरीड मदर. मैं वरी बहुत करती हूँ, और मैं चीज़ों को सोच, और पोस्ट प्रेगनेंसी ये हो रहा था बिकॉज ऑफ द फैक्ट कि बच्चे एनआईसीयू में थे, और मतलब जल्दी हो गया. आई वाज नेवर प्लानिंग दैट, एंड लॉट ऑफ अदर कॉम्प्लिकेशंस दैट दे ऑलवेज हैड इन द फर्स्ट फ्यू मंथ्स. आई यूज्ड टू स्टार्ट थिंकिंग कि मेरे से कभी होगा ही नहीं. सो जो तीसरा सबसे बड़ा चैलेंज था वो ये था कि सेल्फ कॉन्फिडेंस एकदम खत्म हो चुका था बाय द टाइम दे वर रेडी टू स्टार्ट ब्रेस्ट फीडिंग.
So now, as you told me that these were your challenges, then how, like, share your breastfeeding journey with us now, that these were the challenges, and then what happened after that?
So as I mentioned before, I was still trying to put the babies onto the breast, even though I knew that I was barely making 30 ml dono breast mila ke in a day. At the time I met you, and after that, number one thing that you said was to keep latching. So I kept latching despite knowing that probably it's not filling my baby's stomach. And I was also giving them the top up feed. Actually, it was the other way around. The top up was mine, and they were on formula, completely on formula for at least a month or more. And even then they were on formula, and eventually I saw that the boy was feeding better, so I started to wean him off the formula, and he with God's grace stopped accepting formula himself also. He stopped accepting formula, he stopped accepting bottle. Like, he used to get aggressive, he used to not want to take that, as in when I would feed him more and more. And all those smaller things, like drinking more water, I think that is also that I stopped, because जो भी mentally मेरे दिमाग में चल रहा था कि भाई I will not be able to do it, I'll not be able to do it. So वो सब कुछ की वजह से मैंने, I knew that fluid will make more milk, but I had stopped doing that as well. I started doing that, then the whole massaging and making sure that the milk keeps going down the duct. I think all that really helped. Yeah, and eventually when the Lactomagic, the powder that you had suggested, oh my god, that's actually magic. And to everybody listening, this woman here, she's a magician. If you're trying to lactate, I swear, This is not an ad. She has not paid me. And that powder is just absolutely magic. I think the moment I have started taking this, within 2 days or even lesser, I was just, throwing off milk like anything. And the sweetest, I have blessed you so many times, doctor. Every time my babies would make that sound of gulping the milk, I would just send blessings to you.
Oh,
So that
thank you
was that.
so.
Yeah, so I was saying, and the moringa tablets and the oil, I'm sure everything combined helped this make a success. I am not very regular with the oil though, because I have to manage two babies and then feeding and doing everything else. I'm a paranoid mother also, so I'll massage them, I'll bathe them, I'll clean them, I'll do everything else, although I have a nanny as well and my in-laws to take care. But yeah, I mean, it's been wonderful.
Actually, every time when a mother tells me all these things, now these beautiful words, when you tell me, it pushes me more and it gives me more challenges that I should reach more and more mothers, because there are so many mothers who are suffering in silence, or they don't know about whom to reach out. And when you people say these kind of words now, it always gives me challenge, and I feel so helpless. How to reach out to more? If God has gifted me something where I can help out, you got to know about me, but you took some time to reach out, then obviously, because you might be in doubt whether I will be able to get help the needed that one. So
Yeah.
what made you just reach out to me then?
The other mother, the friend mom who actually saw results, and the type of confidence with which she actually referred you to me, that made me reach out to you.
Mm. But you had my number before, as you told me. It took little time for you to reach out.
Yeah, that was my own
Acha, okay, okay, got
mental blockage.
it. Okay, okay, okay.
The thought that I don't think I will be able to do it, or anybody in the world will help me do this. So that duration in which I had your number, but I was not reaching out, that was just my own mental blockage and nothing else. Uh, the reason why I reached out to you was again my friend who had told me that there was absolutely zero milk supply. Her daughter wasn't latching, and with your help she was able to get there. So yeah, that sounded unreal to me, and so I thought, okay, anyway I'm not going to feed them. What if I am able to? So why not give this a try? So
Great.
that was the only reason. That the day I remember I was in the kitchen, I was making dinner, and I just texted you randomly.
So I would like to know, what was your experience with me? How everything went? Like, what do you think that these kind of like work will help to any mother?
I think what you're doing is absolutely amazing, and as you said, it should reach out to more and more people. People like me who have actually had that first sort of experience with you should tell new mothers who might be struggling, as you said, because हम कहीं ना कहीं हर जगह कहीं ना कहीं इसमें इतना ज्यादा शेम भी अटैच्ड है, सिर्फ ये बोलने में कि भाई वी आर नॉट एबल टू ब्रेस्ट फीड और वी आर नॉट एबल टू लैक्टेट. इट्स ऑलवेज अज्यूम्ड कि भाई ये तो नेचुरली होना चाहिए बर्थ के बाद. बट व्हाट वी नेवर टॉक अबाउट इज द फैक्ट कि a lot of times naturally nahi hota hai. People do struggle, and there's a lot of struggle than success that people get initially, right? So I think there is a need for mothers जो कि इस क्योंकि जो इन चीजों से गुजरा नहीं है वो इसके बारे में बात नहीं कर सकता. तो people who have actually gone through this should come out, rather than just saying that, oh, I exclusively breastfeed my babies, and it is so good, it is so nice. Of course it is very good, and while after you've spoken all this, you should also come out and say this, that I was the one who was struggling, and there's no shame, because
Yeah,
I
of
will
course.
go and tell 10 people that I was struggling with mental issues, and there's no shame about it if
No,
you go and
nothing.
take therapy.
Mm.
In the same way, there's so much that a woman suffers in silence because of the fact that the other women are also not talking about it. I
Mm.
think pregnancy, having babies, raising them, everything is a very beautiful thing, but it's not just beautiful. There's a lot of
There is a dark
struggle.
side also, which is not
Ugly
shown.
side also, and
Yes.
I think as responsible women, like what you're doing, we should be talking about this more and more, so that people listen to us and they open up about their own struggles and eventually come out of it, because that's the objective. We are not trying to shame anybody because they are struggling. We are trying to help somebody, and
Yes,
I
correct.
think that's your idea of making this video, and that is the
Yes.
reason I agreed to it. I think on our last consultation day, I was the one who, to add to that, doctor, I think these classes, मैंने भी ये classes miss करी हैं, in the lactation classes, the pre-pregnant, the during
Consults
pregnancy
classes.
classes, and then there were so many other classes that I was already enrolled to. लेकिन मैंने नहीं करी वो classes, and मतलब कोई ऐसा particular reason नहीं था, because I'm not that sort of a person जिनको restrictions या inhibitions है किसी भी तरीके के, but it's just that I never felt कि अरे इसकी क्या जरूरत पड़ेगी. And
Mm.
the biggest problem was that, for example, I never did a lactation class. I was always enrolled in one,
Mm.
right? And the biggest challenge was when I first started trying to breastfeed with my baby, I was actually doing it the wrong way. I was trying to put my body weight onto the baby,
Mm.
right? So these are smaller things that you only understand when when you are going through these classes. What I had to
Actually,
do
you are
was
not wrong.
go through.
I say mothers are not wrong into that. It is just we are not able to reach out properly to them, and we are not able to explain them properly into that. As I already told you that during the Garbh Sanskar class, it becomes very difficult to explain to the mother the darker side also which might come. So वो शायद हम उनको explain नहीं कर पा रहे हैं. And also I would say also the mothers who have become mothers now, एक उनकी भी responsibility है to guide the pregnant ones. प्रेग्नेंट मदर की कोई गलती नहीं है, बिकॉज ऑब्वियसली शी डजंट नो ना, उसको तो पता ही नहीं है ना कि ऐसा कुछ होने वाला है. हाउ शी विल थिंक ऑफ इट? बट दिस इज द रिस्पॉन्सिबिलिटी ऑफ द मदर्स एंड द हेल्थ केयर प्रोफेशनल्स जो कि इस फील्ड में है, that they should create more awareness on these topics. And our discussions like these are the ones कि आगे कोई भी प्रेग्नेंट लेडी अगर उस चीज को समझती है तो वो उसने जो भी क्लास में एनरोल किया होगा ना, देन शी विल गो एंड अटेंड कि मैंने वो लोग का बात सुना था, तो आई शुड गो एंड अटेंड दैट. That is very important into that. Okay, so I would like to ask you the last question. What message you want to give to the expectant and the fellow mothers? So first tell me about the expectant mothers, pregnant mothers.
Um, Pregnant mothers, congratulations, first of all. If you're hearing this, please keep Dr. Tanima's number in handy. And again, this is not an ad. I'm being very honest. You might need it. You absolutely lucky if you don't. God bless. I wish the same. But please do keep it handy and reach out to her in the first instance. Don't wait up. Talk about all your issues to, as she rightly said, the professional healthcare providers. Everything is a nothing is small. You're expecting, you are bringing up a child inside you, but there are larger problems that arise after you've given birth. Do not neglect anything that you are going through physically, mentally, emotionally. It's going to be a ride. So please do not strain yourself if you're not able to breastfeed. If you really want to breastfeed, you will eventually get there. Uh, Please reach out to Maa-Si Clinic. The numbers, I hope, is showing here.
Yes, yes, thank you. We'll do that. Okay, and what is your message to the fellow mothers who have delivered now? And
Yeah, and the same message is for me as well. That talk about it. There's no shame. Um, we've all been there. You're not alone in this. You've not alone suffered this. So if you've suffered and you've done nothing, even more you should talk about it. If you've suffered and done something, please do talk about it so that others can benefit, like I am doing right now. And I will continue doing it, because I have not just suffered here, I have suffered on multiple levels. There's just immense changes that one goes through. So I believe that is what is important. So as mothers, please be responsible towards other upcoming mothers also. That's it.
Thank you so much. Thank you so much, Apoorva, for coming out and sharing all this. I know with two babies, it is difficult to squeeze out that time and come forward and just. But thank you so much for coming and just sharing all your journey with us. Still, we will be connecting, and I am very happy that you just pointed some points which you said that it is not only about breastfeeding or pregnancy. There are multiple things which need to be talked about, and I'm really interested to know about it. If you are really interested, we can talk on that further in any of the other sessions also. I would really
Yes, I
like
would love to.
mothers to who would like to come forward and start some other series also, not only about the Momstar series. We can have another series also where we can talk, because our whole community is having pregnant and new mothers, so it will
Yeah.
be very helpful for all the mothers around, and that
Feel
will be
free
a
to make me your YouTube star,
yes,
Dr.
yes.
Tanima.
I would really ask you to be a initiative. Like, just let me know what all pointers we can cover in the next new series, and we can work on that and get more mothers involved. And let's talk about these things. This is so important. And even it is not about others; it is about me also. I have also gone through a lot of things. Being a healthcare provider, being a doctor myself, all I also didn't know whom to reach out, and it becomes more severe when you are a healthcare provider,
Yeah.
because you know things and
You're
still you are
supposed to
not.
know. Yeah.
Yeah, it is like we are expect मतलब हमसे expect किया जाता है कि आपको तो आता ही होगा,
आपको तो
आपको
आती
क्यों,
होगी, हाँ.
आपको तो आता ही
आपको
होगा.
क्या दिक्कत है, हाँ.
And even now, when my kids are grown up, these things are, motherhood is a journey, a parenthood is a journey, जो कि हमेशा कुछ ना
कभी
कुछ
खत्म नहीं होती.
challenges लाएगी. So it is not only about a newborn and a new mother, it is about parenting journey itself.
Yeah.
So there are a lot of things we need to discuss. We'll surely connect on this, and let's talk about these things, about
Yeah.
parenting and a lot of issues. Thank you
Yes.
so much, Apoorva, and thank you to your husband also. I think because he's around, you keep looking to him in between. Thank you so much, and for your both kiddos also to be so cooperative with us to take to shoot this session. Thank you so much,
Thank you,
Apoorva.
doctor. Thank you so
Bye
much.
bye. Take care. All the best.